Hello friends, and welcome to this 11th and the last episode of this series of Understanding Cataract, a complete guide. If you haven't watched my previous episodes, please go through that. The reason being, I've discussed everything about signs, symptoms, and what actually is a cataract, including the latest treatment that is available for cataract today in India. But this episode is all to do with life after cataract surgery. Most of my patients who come to me for surgery are always worried about one thing, and they ask me that, doctor, is there anything that will change my lifestyle forever? So today's episode addresses exactly that. So why waste time? Let's get into it. Just a quick note on this episode that there is an interview taken by Aparna Ganesh, who's a famous YouTuber, and she has asked me questions which I will be answering on an individual basis. So this is a format that I've been following in this series of cataract. Hello friends, I'm Dr. Kumar, doctor from Dr. Eye Institute, and welcome to this channel of Eyelogues that gives you the latest information of vision and eye care. If you already haven't watched my previous episodes on cataract, please do so. I've shared the link in the description box below. If you haven't subscribed to my channel, please do so, and don't forget to click the notification button, because every time I release any new information on eye care, you will be the first to be notified. In my last episode, I discussed about immediate post-op care and the precautions that you have to take after cataract surgery. But Aparna had a few questions, so let's get into that interview and understand more.
So also, is there a lifelong medical prescription that one needs to have? Is there a baggage of that sort?
Not really. So once you're done with your cataract and done with the 1 month drops, you're done with it.
Fabulous.
But we found that in certain age group, because cataract happens in that age group, we do find a coincidence of them having dry eyes.
Okay.
So for dry eyes, yes, we do recommend some of them to continue the drops for a longer time. Otherwise, nothing.
But not because of the surgery. It's just after
Yes,
effect.
yes. So you heard me right. Once you had your surgery, all you need to do is put drops for a month and the whole regime is over. Because of age, some patients may have some other associated conditions like dry eyes. If so, nothing to worry. The treatment for dry eyes may even continue after the other drops of the cataract surgery have stopped.
So what does the post-surgery process look like once you do all of this?
So initially it was quite tedious, cumbersome. Patients hated us. Now it's become quite simple.
Were they walking around with that, like Captain?
Yeah.
What is that?
The Captain Mask.
Yeah.
No, so now there is, as I said, we are operating on the drops. So really you don't need to patch the eye. The patient goes home with glasses. Previously we used to give black glasses. Now we give transparent glasses. Just for your information, the lens that we put inside the eye is UV protected.
Whoa.
So it's ultraviolet protected. So we really don't need to make you wear artificial sunglasses outside to prevent ultraviolet light from damaging your eye. So the biggest advantage now, as you mentioned, is you are completely spectacle free and you don't need to be depending on glasses after the surgery.
So you don't have to wear dark glasses even after surgery. So you mean you don't even need to wrinkle your eyes?
No, not at all.
You mean your eyes are very comfortable?
Very comfortable.
So not only can you see better, you can even manage the sunlight better.
Yes.
Sounds like party to me.
Yes. So friends, how does it sound? For the surgery so common in our country, does it not have a fantastic outcome? And I'm very happy to say that in today's modern surgery and modern era of laser surgery, the outcome is excellent and visual recovery is extremely fast. So before I end this 11th episode, I've curated all the questions I've got on the social media, as well as so many years of experience of practice. And these questions is what I'm going to tell you, and then immediately the answer that I gave to the patient. So one of the common questions I get in my clinic is this one, that doctor, I'm 89 years of age. I have been diagnosed with the cataract since 8 to 10 years, but I'm not sure if I'm fit to undergo a surgery. Because I've had an angioplasty, I have diabetes, I have blood pressure, although well controlled. The good part is now today we are doing cataract under drops, that is called topical anesthesia. So even if you have diabetes, blood pressure, or you had a heart surgery, it's quite safe to undergo. But the older you are, what we find is that the cataract is very, very hard. And that's the reason why we advise today the patients to undergo the surgery much earlier. Normally the patients say, but doctor, I can still see. I understand that. But please do not wait, because the older you get, more the cataract increases, the harder it gets, all the risks and complications go higher, and your prognosis does not become very good. So please friends, if you have a cataract, go in for a surgery as soon as possible, as soon as convenient to you. Another very common question that I get in my clinic is that, doctor, I have a cataract. I've been diagnosed in another center that I have a cataract. But yes, I can still see. Should I really get operated? This is very commonly asked to me. And yes, I get patients saying the same thing. But yes, you may be able to see reasonably well. But what really gets affected is your contrast. You need more light to read. If you are crossing a road, you may see a blur or a glare coming from the headlights. And that's because you have a cataract. So as I said in my previous answer, please do not wait, because it becomes harder and that gets the surgery more tougher. Friends, what has happened is over the number of years surgery has evolved. You can see my previous episodes of cataract, and that will actually tell you how the surgery has evolved. And that's the reason why previously we wanted a cataract to mature, but now no, we want it to be immature that gives excellent visual outcomes. This is another question I got on my social media, that I'm 45 years of age. I have been to another clinic and they told me I had a cataract. So doctor, at this age, can I really have a cataract? So this is what I had to answer, that yes, you can have a cataract at the age of 45. Very commonly found above the age of 60. If you ask me, what's the youngest patient I've operated a 20-day-old baby. That's called a congenital cataract. So you can have a cataract at 45. There's nothing to panic. With modern techniques, results are excellent, and you really don't need to worry. So another question I got on the social media was, doctor, do you have a laser as an option for cataract surgery? And what I have to say is, yes, friends, there is a laser option for cataract surgery. It's called femto laser. And I would wish that you watch my episode number 6. And that gives you the latest options for cataract surgery. And that answers it all. Another common question I get asked in my clinic is, doctor, how long will the procedure last? Will you really inject my eye to anesthetize this? And what will I really feel? Because I'm really stressed. To which I have to say that, friends, we no longer inject to anesthetize the eye. We use drops as called topical anesthesia. So that fear of injecting the eye is gone. How long the procedure is, it can take anywhere between 3 to 5 to 7 minutes. So it's a very quick procedure. And really there is nothing to stress, because all my patients, of course, you have a right to be stressed, but it's a very smooth process. I've covered a lot of this in my last 2 episodes. So please go ahead and watch it to get more information. Another very funny question I get asked in my clinic, you'll be surprised, is that what is the life of my eyelid? And friends, I have a very humorous answer to this, is that is one thing that will outlive you. So I tell all my patients, even when you go up there, you'll be able to see through the same lens. So summary is that the lens is forever. Watch my episode number 7 and 8, and it has everything to do with Eyelogues. So friends, this brings me to the end of this episode, which was the last episode in my series of Understanding Cataract, a complete guide. Please feel free to make your comments in the description box below, and I would love to get back to you. Stay tuned to this channel of Eyelogues, and please share this information with friends and family. And thank you for your comments and all the encouragement that I've got throughout this series of a topic that is extremely dear to my heart, and that's the cataract.